honor to be recognized tonight by Results, a group that I admire so much for the good work that they have done and who shares my passion for improving health for women and children across the world. And I'm especially humbled to be part of the group of individuals that's been recognized with this award previously. Dr. Stanley Schultz was such an important mentor and role model and hero for me. And it means a lot to be included in a group that includes Dr. Schultz. I think it's especially fitting that we're gathered here this week. As some of you may know, yesterday was World Prematurity Day. And this year, more than 1 million babies will die too soon only because they were born too soon. Preterm birth is now the leading cause of death for children in the world. And most preterm babies who die, they're born in poor countries. And unfortunately, global progress to improve newborn survival is just frustratingly slow. There was a recent study that estimated how long it would take at current rates of progress for a baby who's born in Africa to have the same chance of survival as one who was born in a high-income country. And unfortunately, at current rates of progress, that is 150 years away. So I want to put this in perspective by sharing 2 pictures with you that were taken almost exactly 100 years apart. So the first one, this is a picture that my lab manager shared with me. And this is a picture that was taken in 1910. And it shows his family on their original homestead in Seguin, Texas. They had 8 children, and sadly, the 2 little ones in front, they did not survive to be 5 years old. And that's unimaginable when we think about Texas today, that 2 of 8 children would not survive to their 5th birthday. But 98 years later, I took this picture. I took it in rural Malawi. This is a family who is outside their home. And sadly, the rates of infant mortality in Malawi, when this picture was taken, they're almost the same as the rates of infant mortality in Texas in 1910. And I know that nobody in this room, nobody wants to wait 150 years for these kids to have the same chance of survival as children have today in the United States. So how do we accelerate progress? Well, I think we can only make progress if we keep our focus on newborns. I think that is really the key. We have to strengthen our efforts to improve newborn health globally. So why is it so important to focus on newborns? Places like Malawi have many, many health challenges. Why focus on the little babies? And I think you just have to look at history. History shows us that saving newborns is really the most powerful key to initiating economic development in poor countries. Because when families know that their children have a chance of surviving, then they choose to have fewer children. And families with fewer children, they have more resources to invest in each of those children. They're more likely to keep their kids in school, especially their daughters. And as those kids grow up, fertility rates are falling, then you have more working adults with fewer dependents, and you begin to see the economy grow. So how do we go about improving newborn survival in Africa? Well, in the United States, we really didn't see newborn survival improve until our country implemented a system of regionalized neonatal intensive care units, NICUs, in the 1960s. This is what they look like right here in Houston today. They are full of every kind of equipment imaginable. But today, most African hospitals, they lack even simple tools to just monitor vital signs, to keep babies warm, to help them breathe, to diagnose and manage infections. And unfortunately, we can't just go out and buy equipment that was designed to work in Houston and donate it to these hospitals. We can't just send over incubators and send over oxygen concentrators, because when those technologies get to African hospitals that are hot, that are dusty, that are humid, they fail. When they fail, they end up in places like this. We call it the equipment graveyard, and when I go there with my engineering friends, we all go and we visit the equipment graveyard to pay our respects. And we see rooms like this. This room has 83 broken oxygen concentrators, and most of them are broken because the line voltage spiked and it fried the digital electronics. Or we see things like this pile of 120 syringe pumps that couldn't be used because the hospital couldn't source the only brand of syringe that worked with the syringe pump. What you do find, though, when you visit community hospitals is you see people like Indira. Amazing, dedicated nurses who are working so hard to save babies' lives. But they cannot help every baby until they have access to medical technologies that are explicitly designed to work in cost-conscious, understaffed, environmentally harsh conditions. They need tools that are affordable, that are rugged, that are simple to maintain, and that do not require expensive consumables. And at Rice, that's what we're working to develop. We're working to develop affordable technologies that are essential to newborn survival. We start by asking clinicians what they need to improve the care they deliver. And we turn these needs into design challenges for our students. And these amazing young innovators then take their solutions back to clinicians, and they work to improve them and ultimately to evaluate them in clinical trials. We started this work about a decade ago, about when I took that picture of that family in Malawi. And we're really just now beginning to see the payoff. And you see in this slide one of the first technologies that we developed. It's a CPAP device, and it's designed to help premature babies breathe. And it was developed with support from USAID. And with funding from the US government, we were able to carry out a clinical trial that showed that this device improved the rates of survival for premature babies from 24 to 65%. And that was very similar to the rate of survival that we saw in the United States when we introduced CPAP in the 1970s. And this very simple CPAP system has now gone through international regulatory approval, and it's sold commercially. The sales price is $800, well below the $6,000 sales price for the comparable devices that are available in the United States. And it's now being used to save newborn lives in 23 countries. Now, I don't know about all of you. There we go. For me, the last 2 weeks have been a very, very difficult time, I'm not going to lie. And I've needed with some basic reminders and maybe even a little bit of CPAP myself. So I want to close with something that one of my colleagues did to try and help cheer me up and the other people in our office up on November 9th. She emailed me a blog post that was written by one of our wonderful students this summer, Elizabeth Stone. She is a psychology major who traveled to Malawi, and one of the things that she went there to do in part was to help evaluate a mentoring program to train nurses to use new technologies to improve newborn survival. And Elizabeth had the chance to interview Chrissy. Chrissy is one of the mentors who teaches nurses how to use CPAP. This is Chrissy here, and Elizabeth wrote in her blog, she wrote, "Chrissy told me that when she goes to work each day, she sees mothers waiting in the hallway who recognize her as the CPAP nurse. Chrissy said, mothers come up to me and they say, 'Do you remember me? You are that nurse that saved my son's life.' Or, 'You're that CPAP nurse. Look at my baby girl. She's healthy and she's alive. Thank you, sister.'" Elizabeth continued, she wrote, "I asked Chrissy, 'You really love CPAP, don't you?' And Chrissy answered, 'CPAP is why I do what I do.'" And for me, over the last couple of weeks, it was so important to be reminded of why we do what we do at Rice University. And first, that is to help students like Elizabeth find their place in the world as compassionate leaders who are ready to take on complex global challenges. And second, it's to carry out research, to develop affordable technologies that can end preventable newborn death all across the world. And at Rice, we're really proud to be part of a growing global community of frugal innovators. A community that is working to show that it's possible to develop new technologies and new business models that can improve care in some of the poorest places in the world, and do it at a fraction of the cost of existing technologies that are used today in high-income countries. And with support from USAID and other organizations, our community has created breathing machines like the CPAP device. We've made affordable syringe pumps. We've made phototherapy devices and other technologies that are boosting newborn survival in low-income countries. These innovations, they're making a difference, but they don't yet add up to a NICU for an African hospital. And without a comprehensive approach to newborn survival, I don't think that African countries can succeed in eliminating preventable newborn death. And so we are now laser focused on trying to develop a set of affordable, rugged technologies for a NICU in Africa. And we think it's possible to deliver a NICU, to deliver the 17 technologies that are needed to end preventable death in that setting at a cost of only $10,000 per hospital. So tonight, I just want to end by saying I am so inspired to be together with this community of inventors, of healthcare providers, of nonprofits, of med tech companies. We're all working so hard to try and give children a better chance of surviving and having a healthy life. But especially, I'm so inspired by our students. They are so passionate about eliminating health inequities across the world. Together, we have to do better. We have to work harder to end preventable newborn death everywhere, and to close the survival gap that is faced by newborns in Africa, not in 150 years, but in a decade. Let's all work together to make that possible. Thank you so much.